which is a statutorily designated position. He's also an infectious disease doctor. I promise you he'll give you details down into the weeds as far as you want to go. So with that, I'll turn it over to Dr. Kaiser.
Thank you. I'm coming here today to announce our second case of COVID-19 in a Galveston County resident. The person who is infected is a resident of Galveston County who started feeling ill sometime last week, went to an emergency center, and had a test done at that emergency center. Yesterday at about 9 p.m. the test came back as positive. So here we are calling him a presumptively positive case of COVID-19. At this point, we have no connection between him and any other cases that have occurred anywhere else. He has not traveled. He has not been around anyone who has COVID-19 as far as he knows. And so we believe that this represents community spread within our county. We are very concerned about this, and we believe that this represents a significant change in what has been going on up until very recently. Up until last week, we had no cases, and then the first case was one that there was a clear connection to someone who had COVID-19, and that person had actually traveled outside the county, so we felt as though the exposure was fairly minimal. But now we are very concerned that there may be spread inside the county. With this action, or with this new development, we are asking everyone to seriously look at the current CDC guidelines on what you can do to prevent COVID-19. So this includes particularly people that are at risk, and we're very, very concerned about individuals that are at risk, and by those we will reiterate again, we mean the elderly, we mean people with underlying health conditions such as heart disease and diabetes and lung disease. We're asking those individuals to strongly consider just staying inside for the next 2 to 3 weeks so that they have minimal exposures. We're also asking that organizations and groups look at their plans for the future and ask themselves how they can best implement social distancing. In some cases, this will mean canceling of events. In other cases, it will mean redoing the ways that they have events. The current CDC guidelines are for people who are events that have more than 50 individuals to reconsider having the event, and we would ask individuals and groups to do that as well. We would also ask businesses to look at their practices and to consider different ways that they can ameliorate this. That would be including work from home rules. That would include having more liberal leave policies for people who may be exposed so that they can work at home and not potentially expose other people. For restaurants and other establishments, we would ask them to start thinking about the future and think about if there is more spread, how they would continue to serve their customers by doing things such as dining out options and delivery options as well. We are extremely concerned about nursing homes. And we really encourage all the nursing homes in the community to read the CDC guidelines to make sure that they're in compliance with them. Because one case accidentally introduced into a nursing home could mean dozens of deaths. We saw that in Seattle. And so we're really asking all the nursing homes to review their policies and make sure that they are consistent with it. We're also asking that local doctors would start testing for COVID-19. Unfortunately, what has been happening is doctors say, oh, we don't have the test, and so they send them to the health department, but we can't process a test without a doctor's order. And there are commercial labs that are available, and so we're asking the local physicians to make contact with your commercial labs, see if you can order the test, and we can help you do that if you have any problems. But we believe it's very, very important that anyone who has a test being done have an evaluation being done, also looking for other things besides COVID-19. We expect to have more testing available in the county within a week to 10 days. Currently, we're being able to do about 25 tests a day. We expect that to increase within the next week or so, and then to potentially hundreds a day, and then within 2 weeks to the point where we can do thousands a day. Once we have those numbers of tests available, we will be able to set up testing centers around the county where people who are concerned can come in and get a test. It's going to be very important to us as well as a health district, because that will allow us to have a better sense of just how much virus there is in the county and how rapidly it's spreading, and then advise people in a little more informed way about what they need to do to try and prevent infecting themselves. So with that, I'll stop and take any questions.
Kaiser, two questions here. One, which clinic of UTMB did this patient go into, and also can you give a general area of where in the county he lives?
Yeah, so he lives in the northern part of the county, and my understanding is that he went to a clinic on the mainland, but quite honestly, I don't know exactly which clinic he went to.
In northern part of the county, is there a specific municipality attached to that?
No, we're not going to name specific municipalities because of the concern of inadvertently identifying people. So we try and keep it very generalized.
Is it within the confines of a municipality, or is it county?
That's all I'm going to say.
When did he first, what was the timeline? When did he first present symptoms? And when did he
Don't know. We're still reviewing this. Remember, we got the word on this 9 o'clock last night. Okay, so our epi staff is working with his physicians to get all of that information about him. We do know that he presented on Sunday and that the test was run Monday and the result came back Monday night.
So did he notify them that he was coming in with these kind of symptoms so
I
they could prepare?
I don't know the answer to that, but that is something that we are asking people to do, is that if you think you have symptoms, please call ahead so that you can be greeted in a proper way, let's say. If you just walk in and say, I think I have COVID-19, you can expect a lot of hysterical responses, and so calling ahead would be very good.
Is he being treated right now, or is he in isolation? What is his...
Okay, he does not need hospitalization, and he is at home. We will be issuing a control order, which will tell him to stay at home until we deem that he is no longer infectious. We will also look at his contacts, and if anyone has had a significant contact with them, we will also issue a control order for them to stay at home.
His age?
40-something, I think, yeah.
Well, was he working from home? Was he at an office? Like,
Don't know. Don't know any of those details yet at that point. So our standard practice is to look and try and evaluate where there were significant exposures. We will then go and notify those places so that they know what to do. We don't want to label any particular business as you know, being someone who had COVID-19 there, because it could just kill their business, when in fact it may not have been a significant exposure. So our process is that we will notify those businesses and those places individually, and then they can do with that information what they want. If they want to make it public, they can.
How quickly do you start asking him where he's been? Did that happen
Today.
8 a.m., 7 a.m.?
We found out about it at 9. I found out about 9 o'clock. I think the health district staff found out about it 9:30, and as soon as they first came in the morning, they started contact.
When these questions are asked of him, has there been anything initially to indicate that he has had contact with folks at the higher risk area?
No.
Elderly, nursing home?
Not at this point. Not at this point.
Your extreme concern isn't based on his contacts.
Our extreme concern is not based on his contacts. It's that he got it somewhere around here, and we don't know where. And that's the part that's worrying us.
Just to be clear, because obviously Harris County made the decision to close restaurants and bars yesterday. Is there any recommendation like that coming for Galveston County?
Well, so we're looking at several issues. Okay, so I think there are 3 issues here, right? One is, what is the legal authority? Okay, and we're looking into that to make sure that we have the proper to make sure we understand what we as a county and we as a health district have the legal authority to do, which may be different from the cities. Okay, and so you're going to.
What about Harris County?
Well, yeah,
You have the
Well, let me finish that. I'm not saying they did anything wrong. Please don't get that. We just want to make sure that we understand where we are, and so that's issue number 1, and that we do everything in the right way. The second thing is, like, what can we do, and then what should we do? So we're still assessing what should we do. So what we want to do is we want to get the message out that this has happened too. We want you to look at the CDC guidelines. We want you to look at what Harris County's doing. We want you to think about, is this something I need to do? And I can tell you, I've been doing this business for a little while now, and I can honestly tell you, you get more cooperation when you persuade people as opposed to when you start telling them you must do this. So we would like people to think about where they are and do the right thing and do unto others as they would have done to themselves.
So
I take no position on the matter.
Yeah.
But, I mean, isn't time of the essence? Isn't, if you're gonna make a move to have restaurants and bars stop dine-in service, to do that right now?
Right. And so, okay, but no, there's a medical issue there as well, okay? So, right, yes, there is. But if you also look at the development of it, we probably have the few days to week to make those decisions, because now we're at one case. Harris County has 8 cases, and they know things they're not telling you, okay? So right now, we have time to go through and look at both legal authorities and also what are the proper recommendations. The other thing is that these recommendations are a moving target. So we're looking at CDC recommendations which were issued on Friday. The President's Task Force issued a different set of recommendations on Monday. CDC hasn't reconciled those things yet, all right? And so we're trying to make sure that we get the most clear, best guidance to give people. So, Judge?
Okay, with respect to bars and restaurants, there's a couple of different issues there. I do not believe I have the legal authority to do that. Section 418 of the Government Code gives me powers under disaster, which I do have. If I read those the way that I read them, I can apply uniform hours to businesses. I can't pick and choose. But let's get past Section 418 of the Government Code right now and talk about the U.S. Constitution, which forbids me from depriving you of liberty or property without due process. So I think if we got past Section 418, I'd still have a constitutional problem. As the doctor mentioned, cities might have some different tools to work with. I don't have them. I don't believe I have any authority to close bars and restaurants.
Meaning that Harris County doesn't either, in your view?
That is my opinion, correct?
Judge, the fact that I know that you are an owner of a bar restaurant.
Not anymore.
You're not anymore?
No.
Okay. So, but I talked to the state. They said that you do have the legal authority, at least to close down beaches as well, and I've talked to attorneys.
Correct.
Have you considered closing down the beaches at all?
If the local health authority tells me that that's a significant risk for spread, then yes, we would definitely consider that.
Right.
But have not heard that.
You suggested Houston had some information they weren't sharing.
That wasn't me.
No, that was me. All I'm telling you is that when they go through these things, they know, like I say, they know a lot more. They're tracking, and we're tracking as well, say, for example, the number of phone calls, tracking the content of those phone calls. So I suspect they're hearing things that have raised their level of concern. Right now, most of the phone calls that we get, for example, are people describing symptoms that are probably not COVID-19. On the other hand, with one case, and 50% of our calls are people are describing COVID-19, if that were to happen, we would be very concerned. So we have a lot of different pieces of information that we bring in together to try and make these decisions.
Dr. Kaiser, how many people have actually been tested so far?
Right now, I don't have the official number, but it's somewhere in the realm of 150. So we have a very small sample size with which we're trying to make these decisions.
I'm a little confused about who's doing the testing. I know you are both the health authority for the health district and
Right.
you work at UTMB.
Right.
Is this UTMB testing UTMB patients, or is this the health district
Right.
testing patients?
There are multiple venues for getting testing. So the official way, if we may call it that, is to refer a test to the health department. We then vet that individual to see if they meet CDC criteria for testing. We then send that up to the state lab, which is running tests in Houston. Now, the state can turn down those tests because they say, no, I'm sorry, it doesn't meet the criteria. And that happens. And so if we feel strongly that that test needs to be done, then I have to get on the phone and ask for an exception. UTMB has developed their own test, which is an in-house test, and they are doing that test. Right now, they're doing it for patients that are being referred to them.
When you say there are 25 people a day being tested, does that include people at UTMB?
Yes, that does. UTMB is doing about 20 to 21 tests a day, and we're probably running about 5 or 6 tests a day. As you can see, that's not nearly enough. We need to do more.
And along that lines, you talked about private doctors going in and seeing patients and
Yep.
working with private labs.
Yeah.
Is there any concern, though, which labs can and can't handle
The labs are going through, they're being overwhelmed as well. So some of them today said that they're going to put a hold on testing for a day or two. That doesn't mean they can't do it. It just means that you've got to check and see if the private lab can actually do the test. There are 3 labs that can do it: LabCorp, Quest, and another lab called ARUP. And we would recommend that all providers contact whatever lab they deal with and see about availability of the test. If they can't get the test through that individual, we would be happy to work with them to try and get it sent to the state. But we want the doctors to evaluate the patients and draw the test and then let us process it.
You told us yesterday that the 2 patients in Brazoria County that were identified actually worked in Galveston County.
That's correct.
Can you talk about the investigation into their contact?
Sure. Sure. Initially, there were over 100 people that they had contact with. As of yesterday, that list had been narrowed down to potential contacts of about 40-some. I don't know where that stands right now today, but anybody that's investigated of that group that has a serious, what's deemed to be a serious contact, is going to be asked to stay at home and to self-monitor and report that to the health district. At that group of 40. So of that over 100, a significant number have been cleared.
Of that 40, are they Galveston County?
Those are people in Galveston County. We are not investigating contacts outside the county.
Can I ask one follow-up regarding bars and restaurants? I mean, you guys hold the licenses that they need to operate. So
Right.
clearly you have the authority in that sense that you could pull those licenses.
That has been suggested, and we're not sure that's the case. We are working with the Department of State Health Services as well as
How
with.
can you not have clarity on these important issues during this time?
Well, one, things are changing very rapidly. 2, we're not sure we have the statutory authority to pull their license under a health crisis thing. We can pull their license if they break the rules. We can pull their license if they're dirty. We can pull their license if they have someone who's sick working there and exposing other people and don't do something about it. But so there's a very clear set of statutory authority that allows us to do that. So we're looking into that as a potential option, but we don't know if we can do that.
There's no other county that has the same point of view, though. There's no other Texas county, I believe, that has this point of view that you're putting forth right now, that they don't have the authority to do this.
No, I'm not.
All over the
Okay,
state.
let's just stop. I'm not saying we don't. I'm saying we're going to find out.
At what point will you have legal clarity on this question?
When we
there's
talk.
attorneys all over the place, right? So
Yeah. No, so we're looking to the Department of State Health Services to give us guidelines, and we're looking to the State Attorney General to give us guidelines. So
Also,
we're taking it up to the top.
Is there concern that there are going to be folks from Harris County coming down to Galveston? knowing that
Absolutely.
Bars are open and closed?
Absolutely.
And today's St. Patrick's Day, that people are drinking?
Absolutely. Sure. We're concerned about that.
Dr. Kaiser, if you right now.
But I can no, let me address that. Absolutely. We had a scenario earlier in the month where a large healthcare corporation wanted to send their infected people down to a hospital here without clearing it with us. And initially I said, no way, putting your foot down. And we checked that out with the State Department of State Health Services, and they told us that we cannot do that unless the Commissioner of Health declares a general public health disaster. And that's the only way that we can prevent entry and egress into the county. So the laws are a lot more complex than a lot of people believe, and we've tried to push the envelope on some of that stuff, and so we just want to make sure we've got it clear before we take any action.
One follow-up. This is the Office of Emergency Management, where you have plans for every sort of contingency, yet you don't know the answer as to whether you have the authority to close restaurants and bars. A lot of people don't think that washes. I mean, this is where you figure that stuff out beforehand.
Well, we're trying to figure it out beforehand. Maybe we should have had the press conference an hour later and we could answer that.
Don't
But
you
anyway.
hold the occupancy permits for these restaurants? Can't you reduce that to less than a smaller number than what you're allowing them now?
I don't know the answer to that.
The county does not, I can tell you that. We do not issue occupancy permits.
Well, who does?
Cities.
And so can't we work with the city to get these restaurants and bars?
Right,
closed?
so the city of Galveston has already said that they're not issuing any more permits for people under 250. We don't know what they're going to do now with these developments.
The governor has activated the Texas National Guard. This is an emergency. You still don't believe you have the authority to close restaurants and bars, given that?
I don't know whether I have that.
We're going to take 2 more questions.
I mean, Dr. Kaiser, if you clarified you had that authority right here, what would you recommend then?
What would I recommend? I would recommend that, that people do what we're asking them to do, to look at what their plans are, and then we will continue to monitor the situation and probably in a couple days make some, in a day or two, make a decision.
But again, if you had that authority, where did you right now tell the judge, yes, go ahead and shut them down?
I'd have to think about that, in all honesty. I'd have to think about that.
What's your hesitance? I don't understand. Why would you have to think about it? If you had the authority, why do you still need to think about it? What's your hesitance?
My hesitance is that the flip side of the other sides we're seeing. We're seeing widespread panic. We're seeing buying sprees. We're seeing critical loss of businesses, and we want to make sure we get it right.
All right,
Health
we're gonna
doesn't
wrap it
come
up now.
first.
Thank
Health
y'all
comes,
for coming
health,
out.
health comes first, but we want to make sure we get it right.
And where do you consider the levels of testing need to be at this?
We need to be doing thousands of tests a day.
All right, thank y'all for coming out. There's, if you have any, if you need a copy of the press releases over here to the side.
Nothing more, Judge?
Oh, I'm sorry, yes. I will be issuing a disaster declaration this afternoon for the purpose of issuing a price control order. A price control order is a directive that prevents or at least allows criminal prosecution of price gouging. So I've been talking to the district attorney this morning about what he needs in that order. So the disaster declaration will be to facilitate that price control order only at this point.
Only.
Yes.
It won't change your disposition in terms of bars and restaurants?
It does not give me any more authority than I already had, correct?
You could tell the mayors in Galveston County that you'd like to see something done. Mayor Yarborough has already talked about, he thinks he has the authority.
The cities may have the authority. I said that earlier.
Why
So
don't you just give the cities the authority?
Well, why don't
I
you?
can't
why
confer
don't you
authority that I
ask-
don't have.
Why don't you just tell the cities
Why don't
to,
you ask them
The,
to
the cities,
recommend that
the
they-
cities can make their decisions for themselves. They have the same access to the same information I've got.
Why don't y'all recommend it, even though you don't have the right supposedly? Why don't you recommend it?
We do recommend following the CDC guidelines, absolutely. He said that several times. And the CDC guidelines say limit your activity and your exposure in such establishments where there's 50 or more people or 10 or more for the critical population.
There's a difference between, this is a difference in your mind, a difference between recommend and order. Is that?
Correct.
what we're about to-
Correct. The,
You're recommending it, but you're not.
we recommend you follow the CDC guidelines, correct.
Okay, we're wrapping up the press conference. Thank y'all for coming out.